Hello, I'm Robin Begley, Chief Executive Officer of the American Organization for Nursing Leadership. I also serve as the Chief Nursing Officer and Senior Vice President of Workforce for the American Hospital Association. Let me begin by providing an overview of AONL. AONL is the National Professional Association of more than 10,000 nurse leaders working in hospitals, health systems, academia, and other settings across the care continuum. AONL is the voice of nursing leadership and an affiliate of the American Hospital Association. For more than 50 years, the organization has led the nursing leadership field through professional development, advocacy, and research to advance nursing leadership practice and patient care. Our organization brings together an inclusive network of nurse leaders who celebrate diverse perspectives and embrace new ideas. We serve nurses at every stage of their leadership journey, from emerging leaders to seasoned executives. AONL believes every nurse has the potential to be a leader, and we are dedicated to inclusivity of all nursing leaders. COVID-19 has affected everyone's lives and changed the way we operate. It has greatly challenged our healthcare system, tested leadership skills, and profoundly affected the caregivers on the front lines. In these times of darkness, there have also been glimmers of light. We learned many lessons in patient care, seeing the importance of interprofessional teams, and began to utilize technologies in new and different ways. And the greatest ray of hope, the development, distribution, and administration of multiple vaccines in record time. Looking back on the past year, we know nurse leaders introduced new strategies to meet patient care needs, to reallocate internal resources to adapt to influxes of patients, and we quickly pivoted when circumstances changed. AONL fielded a pulse check survey of more than 1,800 nurse leaders in July, following the initial surge, to understand the primary challenges facing nurse leaders and best practices moving forward. Survey participants included nurses at all leadership levels, mainly in the hospital and healthcare setting. The primary challenges at that time were access to PPE and other supplies, communicating and implementing changing policies, sometimes on a weekly and even daily basis, surge staffing, reallocation and training, and emotional health and well-being. AONL fielded a follow-up to that study of nearly 2,500 nurse leaders in early February following the winter surge. Participants included nurses at all leadership levels across the care continuum. In comparing the results of the two studies, we found surge staffing and the availability of healthcare workers remained one of the top 3 challenges facing nurse leaders. The number 1 challenge, however, now is the emotional health and well-being of healthcare workers. These issues are not specific to just nursing. It includes physicians, respiratory therapists, transport specialists, environmental services, and really all clinicians and staff and healthcare leaders alike. As a result of these studies and hearing from our members, AONL developed numerous researches and services to help healthcare leaders lead during this crisis, and especially how to address burnout, moral distress, and build resilience. As we look at lessons learned from the pandemic, we have seen the value of technology and recognize its efficacy. According to AONL's Nursing Leadership COVID-19 Insight Study, the utilization of telehealth was the number 1 temporary advancement that nurse leaders will continue to utilize. Telehealth helps improve access to care and allows patients to safely receive care from their homes or community. One of the biggest lessons learned is the importance of addressing the social determinants of health and systemic racism in healthcare. COVID-19 really exposed the disparities in care and the need for health equity. Diversity, equity, and inclusion is a strategic priority for AONL, which we address through education, advocacy, and community. We believe it is critical that the nursing workforce and leadership reflect the patient population and communities served. AONL has created resources to help nurse leaders implement and foster a workforce diversity and inclusion program within their organizations. These tools also address bias and examine how institutionalized and systemic racism result in inequities in care. In closing, I'd like to thank you for the opportunity to discuss nursing leadership's challenges and opportunities learned during this public health crisis. I invite you to visit aonl.org to learn more about the initiatives I mentioned today. Again, my sincere thanks for all you do for your patients, your community, and for nursing.